Hello and welcome to season 4 of the NGO Whisperer show. My name is Dr. Carolyne Opinde. I am the founder of the NGO Whisperer and the convener of the NGO Whisperer Masterclass, the official sponsors of the NGO Whisperer show. Here at the NGO Whisperer, we provide technical support to nonprofits and social enterprises so they can successfully impact people's lives. Joining us today for part 2 of Demystifying Endometriosis is Elsie Wandera. She is the founder of Endometriosis Foundation of Kenya, a member of World Endometriosis Organization's steering committee, and a menstrual health hygiene management champion. Elsie, welcome to the show.
Thank you. The conversation is really lovely and I'm enjoying myself.
Ladies and gentlemen, we are demystifying endometriosis today, and we would like you to really listen keenly and begin to identify if there's someone in your community, in your household, in your school, if you're a teacher or a fellow pupil, look at the girls and help them to identify these. As Elsie has mentioned to us, it may take very long for it to be diagnosed in someone's life, and it's usually just brushed off as painful periods. Now, going into the next issue that we're going to be talking about, Elsie, how do you identify the women and the girls that you serve through your nonprofit?
We have been very lucky to leverage on technology and the existing digital platforms to just be able to reach out to the women. So that is how they will hear about us. That's how they will hear about the Endometriosis Foundation of Kenya. We continue to host events to just make sure that, they can come and also hear from medical experts and other experts, whether it's nutrition or health, lifestyle experts, in whatever category that is. We continue to just engage with them. So the way that we are able to identify the women that we work with is really, it's an open door for us policy. So there's no criteria. I think the primary reason you would want to join or be part of the Endometriosis Foundation of Kenya or the community is that first you're presenting the symptoms and you're going through the challenges that I described earlier. And the other thing is just making sure that when they join, we are immediately directing them to the medical experts, practitioners that we know who are endometriosis specialists. So not only a gynecologist, but an endometriosis specialist, because you need an endo specialist who can be able to shorten, again, the diagnosis period, because you'll hear from a lot of women that they'll have gone from between 0 to even 5 gynecologists in their lifetime before they actually get a doctor who can help them. So for us, it's to shorten that period. And even when we talk to parents and when we talk to the public in general, one of the things that we help them, and equip them with is information to say that if they are able to identify a woman around them who is going or presenting those symptoms, is to direct them to us. So it's an open door to anyone who wants to be a part of the community, even though they want to just encourage the women themselves. They don't also have to be patients themselves. But for us, it's critical that, of course, you're presenting those symptoms, because then you're our primary target. But I think what we've discovered and what we know is that because we are still far along in terms of the entire country understanding or even being able to articulate and even say that endometriosis is a real issue, we're still far, but we're definitely not where we were when we started. So for us, it's about equipping society. And so if it means we even have gentlemen joining, we do that and we counsel them. So even if it means that we're talking to husbands of endo warriors or partners of endo warriors, we do that and just give them the counsel and the advice, just how to take care of a patient and how to help her just ease that burden and the costs that are related to their own maintenance and personal maintenance.
Wonderful. Once again, ladies and gentlemen, there are many symptoms that present themselves and it varies from people. And I would just like to share some symptoms as Elsie has shared with us, pain in your lower tummy or back. Pelvic pain usually worsens during period pain that stops you from doing your normal activity, whether it's going to school, going to work, or even sometimes just being at home and you just feel like you can't do anything. And then there's also pain during or after sex, pain when peeing or going for a long call, or number 2, as we call it, during your period, feeling sick, constipated, when you feel like you have that diarrhea or blood in your pee during your period. And one of the things that Elsie has shared with us is also difficulty getting pregnant. That could also be, if you have all these myriad of symptoms, it could be an indication that you have endometriosis. Speaking of which, who are you partnering with to serve endo warriors in Kenya?
The partnerships that we have are many. So I think having the support of the Kenya Obstetrician Gynecologists Association is key. I think we hosted together with the University of Nairobi the first East Africa Endometriosis Conference. And, we had not only the advocacy organizations like myself as the Endometriosis Foundation of Kenya, but we also had medical doctors, the clinicians, and then we also had the scientists. So for me, those are my partners. Those are the most important people that we must work with. One, because they're the first point of contact that the woman will have when it comes to this condition. And, because we believe that they're also the gateway to the insurance companies. They're the gateway to also helping demystify this condition, even to the public. So we collaborate and work closely with a lot of doctors, but particularly the Aga Khan Hospital and MP Shah have been very, very welcoming to us as an organization. And they have got centers of endometriosis that they are setting up in those 2 facilities. They also have got endometriosis specialists who are working there. And they've got also a multidisciplinary team that they're setting up. And that means not only the gynecologist, but pain specialist management. Then they've got also a radiology team who are in charge of imaging, meaning they are raising up an entire team who, from end to end, when you think about the journey of the woman who is suffering with endometriosis, as long as they're going, they're going to visit them for whatever reason, whether it's to get pain medicine, whether it's to get imaging done, these people will have an eye and an ear for the symptoms that they're presenting or the issues that they're presenting, to be able to diagnose it and deal with it faster. And just make sure that it's easy, because imagine with me how much painkillers I have been on since I started, presenting the symptoms. And I just imagine that it would have been much better if it was diagnosed earlier. And so for us, our primary partners are the medical doctors themselves, and the gynecologists and the doctors that we have working with us right now. We do have a couple of scientists that we also work with in terms of just making sure that, we can apply for proposals together to conduct studies in Kenya, because one of the other things that we believe as the Endometriosis Foundation of Kenya is, just bettering and improving the, just the understanding by providing a better description of the prevalence of endometriosis in Kenya and demonstrate the impact that it has had on these women, because the data that we have right now is very Caucasian. So it's not anything that represents Africa. And if you also do some history to understand endometriosis, for a very long time, it was defined as a Caucasian condition. So it wasn't, so the studies we know that exists today do not cover Africa or Kenya. So we really, or even just the Black Americans and in general. So that's why it's paramount for us to then partner with the universities, for example, to help us with the studies, because again, I'm not a specialist in any way. I'm just a passionate woman who's leading this cause, but I want to see that change and transformation happening. And then, of course, last but not least, engaging with government. So we do have some partners from government that we work with, and currently I also sit on there's an MHM, menstrual hygiene management workplace committee that's doing some work in terms of just trying to see how can we come up with policies that will also be translated and enforced within the workplace to make sure women have a dignified experience. So that's the kind of partnership, I guess. From a partnership perspective, those are the places and the spaces that that I am in, and that we work with to just make sure that women get a chance at a better quality of life.
Thank you so much. You have achieved a lot since the founding of Endometriosis Foundation of Kenya. I know you also sit on the World Endometriosis Society, and from that perspective, collaborating with other players from different countries, bringing in and sharing knowledge and expertise, I believe that is going to take us further in collecting data and having evidence-based responses to help people. Now, during
Absolutely.
COVID, I know a lot of interventions have been affected. How were you impacted by COVID, and how have you pivoted as an organization?
It's a good question. I remember, so we were getting ready for a big event, the annual World Endometriosis event that we host every year. We were getting ready for that in 2020. And it was in the month of COVID that the first lockdown happened in the country. And of course, that then, meant that we could not have the event. We couldn't, which we always look forward to, because we have got such high participation from the public. And then, we have, like I said, we have an array in terms of the panel of experts from different fields coming together to just share. But that did not stop us. And I'm really glad about that, because yes, it might have stopped physical meeting, but I think what we did is we made sure that we would send out invitations to ladies and the public in general as well, to be a part of Zoom hangouts with the doctor or whichever experts that we would have on board. And that has been going on. I think we slowed down a bit, but we have leveraged as much as we can on technology, and just made sure that, of course, COVID is not slowing us down. But we have also seen the impact just the burden of COVID and the pandemic on the whole of society. So as much as possible, like whenever women would be sharing some of their challenges within the group or within the community, is to always direct them to, therapy, to make sure that they're speaking to someone to help them process everything that they're going through. Because yes, endometriosis is just but one piece of what they might be actually going through, but there is actually a lot of stuff that we're going through, and when you put all that together, it can be quite messy. So that is primarily the support that we offer. But we also have an interesting program that we call the Endo Buddy, where we pair up women. So like you, for example, you and I, would be paired up. And because, like sometimes we find that it is difficult for some women to speak in the groups, and, they're just the silent kind of followers, but they do actually need someone to talk to. So as a way to mitigate, just that silence and and that feeling like I cannot be seen, I'm not being heard, was to create that buddy system, to make sure that if I'm ever feeling down, I can always call you, Carol, and we'll talk, we'll share, we'll meet up, and we've seen friendships born out of that. So that has really helped also during the COVID times.
Wonderful. Creating a peer system is really critical in any form of intervention. It's been proven the peer system works, and even with Endo Warriors, as you have mentioned, that worked for you and continues to work, not just during COVID or pre-COVID, even before. And so we just so honored. We just so honored that you're doing amazing things for women and girls in Kenya and around the world. And for those who may not know, March is Endometriosis Awareness Month, and it was set up in 1993. It is observed worldwide with activities on education, on raising funds, and on marches to raise awareness, and also to build up on research, which is lacking. And as Elsie has shared with us, research is really lacking, but we know from what we have gathered so far, if you have 10 women in a room, at least one of them may be living with endometriosis. And so that is a very high rate of endometriosis. People may not understand it. We don't know its causes, but women are experiencing it, girls are experiencing it. Another thing that Elsie has shared with us is that if all the women and girls experiencing endometriosis would be put into a country, they would be the 8th largest country in the world. That is a huge population. Ladies and gentlemen, whenever a woman is suffering from what you may think is period pains, do not brush it off as period pains. That woman, that girl may be an endometriosis patient, and she needs support. She needs you, and she needs all of us to help her live through life and enjoy her womanhood, enjoy her life. As we come to the end of this show, Elsie, I would like you to give a message to the government, to civil societies, to good citizens on supporting women and girls living with endometriosis.
My challenge to the government is to try and see how we can fast incorporate endometriosis and other reproductive health issues and disorders into the existing MHM policy, because we have an MHM policy as a country, and that's worth celebrating. I think for me would be, let's see how we can quickly turn that policy into action. I would like to see us going into schools, and of course, I mean, that has changed now just because of, COVID and the times, but we would love to come in into schools and educate, especially the young girls who are at their formative years, so that they can be able to identify endometriosis early, and then of course have it taken care of sooner. But also just making sure that we equip the caregivers who are around them. So I think for me, it's, yes, we cannot do this work on our own. And for us, it's saying, if other organizations are doing anything similar, can we come together? And I think, because if we come together and we unite together, I think we have a better chance of being heard by the government, especially when it comes to research, because we know that it's expensive. So it's not, unless like you get you get funded for that, which again, we have applied for very many, but none has come through. And I'm like, would especially the funding partners who are out there, consider funding this condition, studies to be conducted for endometriosis. I know we've got fantastic researchers and scientists who are in the country who have contributed to the global efforts in terms of just trying to find a better and definitive way, an easier method, and a less invasive method of diagnosing endometriosis. And I think like that's what's celebrating. So let's recognize those people, but let's also enable them. So let's just make sure that they get the funding to be able to do the studies that they need to do. But I think also, speaking to the insurance companies, I always say this, like that's usually like my parting shot. I'm like, the women who are suffering with endometriosis deserve to get access to healthcare, just like any other person who is suffering from whatever condition they are. It is that important to us, by the way, that we have the quality of life, because we deserve it. We did not ask for it, for this condition. It's not something that we're imagining. It is proven. It is a condition that actually is it's actually a true condition. So I think join us in the cause by making sure that we're supporting these women who are suffering by providing them with equal opportunity and access to healthcare, especially the people who are in the rural areas. So for me, I think it's also to challenge government to just make sure that at least every county hospital has a specialist who, someone who specializes in endometriosis, and that all the county facilities also have laparoscopy facilities, so that people do not have to come all the way from around the country to the one hospital that we have to be serviced. So I think that and many more are other things. I think I could go on, but I think those are my primary ones, that if we give endometriosis the attention it deserves and make it part of the national agenda, would be a fantastic thing.
Thank you so much. Giving the endometriosis a role, raising awareness about it and making it part of the agenda at the national level is what is required to raise awareness, advocacy, to raise funds, and also work with insurance companies to ensure that women, regardless of their economic status, would be able to get the medical help that they need. Thank you so much, Elsie. Where can people find you?
So we definitely are on social media at the moment. That's where we are active most. We have a Telegram group as well. Because I think we found that, being on WhatsApp, like WhatsApp cannot accommodate big groups of people. So we have, most of our conversations and activities happen online. We do not have a physical office at the moment. But when we do, we will make sure that we put that up out there. But for now, people can find us online, and on their phone contacts, their emails, that they can reach out to us. And we are very, 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 very happy to respond to anyone who has any questions or any opportunities for us to get involved in whatever way.
It's been an honor. It's been a pleasure to have you join us for the last 2 weeks as Elsie and I have been discussing demystifying endometriosis. Elsie Wandera, our Indo warrior from Kenya, member of the World Endometriosis Organization Steering Committee and menstrual hygiene management champion. We are so honored to have you on our show as you raise awareness, educate us on what endometriosis is and what help is available for any woman or any girl, not just in Kenya, but around the world, on what help they can get. Thank you so much. We are so honored, and we wish you so much success in everything that you do to support endo warriors around the world.
Thank you very much, and really, really, really honored. And I also celebrate the work that you're doing, Dr. Opinde, in just bringing us together and also empowering us and equipping us and just helping us also realize our potential, even beyond the countries and the spaces that we operate in. So thank you very much for everything that you do for organizations like ours that are out there. Thank you very much again.
Thank you. We are just so honored. Ladies and gentlemen, remember to connect with Elsie Wandera on social media and on their website, and follow us on social media and subscribe to our YouTube channel to watch more educational, inspirational, and motivational shows like this one. Go to ngowhisperer.com/masterclass to sign up for upcoming masterclasses that we have set aside for you for the months of July all the way to December 2021. As always, it's all about connecting people, raising funds, and impacting lives globally.